there's this sort of feedback loop where there's something wrong with your muscles or your tissues, and that causes pain. And then the pain causes your brain to basically create more tension, and more tension creates more pain. And this feedback loop from muscles, pain, brain, I say strain, pain, brain, that feedback loop's going to keep coming back. And in some cases, that continues even after the original injury is healed.
Welcome to the Radical Health Rebel podcast. I'm your host, Leigh Brandon. This work started for me several decades ago when I started to see the impact I could make on people, helping them to identify the root cause of their health problems that no doctor could figure out, including serious back, knee, shoulder and neck injuries, acne and eczema issues, severe gut health problems, even helping couples get pregnant after several IVF treatments had failed. And it really moves me to be able to help people in this way. And that is why I do what I do and why we have this show. In this episode of the podcast, I speak with Ben O'Loughlin, an expert in the Alexander technique. We discuss Ben's personal journey with chronic pain and how he discovered the Alexander technique as a solution. The conversation delves into the role of the brain in muscle tension, the importance of active engagement in healing, and the misconceptions surrounding chronic pain. Ben discusses the significance of self-management and the mind-body connection in pain perception, and we explore how Alexander technique can benefit musicians by enhancing their performance through improved posture and relaxation. The episode concludes with Ben sharing his innovative approaches to teaching the Alexander technique. Ben O'Loughlin, welcome to the Radical Health Rebel podcast. Thanks for coming on the show.
My pleasure, Lee. It's beautiful to meet you, and I'm looking forward to the conversation.
Yeah, likewise. So to start us off, Ben, what led you down the path of exploring Alexander technique? Was there something in your own health journey that kind of led you down that road?
Oh, yeah. I mean, I had really terrible back, neck and shoulder pain, and I used to get a lot of tension headaches at quite a young age, sort of in my early 20s, 21. And I didn't know what it was that was causing these things. I'd heard there was a connection between psychology and tension and stress and all that kind of stuff, but I could never really make sense of it. And I tried all the usual things. I tried massage and, acupuncture and dry needling and physiotherapy and all of that stuff, and nothing really stuck. I mean, and some of it gave me temporary relief, but I came across a guy who taught Alexander technique, and the very first lesson, I was just, it made a huge impression on me. I was kind of gobsmacked at what I learned in that lesson about how tension in many cases comes from the brain and not from the muscles.
Mm. So how long was that journey between, you started getting the symptoms of the back pain, the neck pain, etc. How long was that journey before you kind of came across Alexander technique?
Yeah, well, it's a little bit hard to say because it kind of creeps up on you. I mean, unless you've had a traumatic accident, then this kind of chronic pain can just kind of sneak up on you. And, before you know it, like I just remember one day, I woke up and I was in pain and I had a headache, and I just kind of lay against the headboard to sort of stretch my back out for like 20 minutes before I could get out of bed. And I reckon I was like that for probably a year or two. And probably a year before I thought, hang on, I better do something about this. It's funny. I hear it time and time again. People have chronic pain, but they just haven't done anything about it. And I was no different. I probably had it for a year or two. And then I started, investigating and trying to get different treatments. And I tried meditation as well and all these different things, and all great, great stuff, and work for some people, no doubt. But it didn't work for me. So I reckon a few years of creeping up on me, and then maybe a year of sort of searching.
Yeah. So what I was about to ask you then was, so how did you come across Alexander technique?
Well, it was a fluke, really. Like just serendipity, because a friend of my sister's at uni, I was having coffee with him. He's a friend of mine as well. And but he was in my sister's year. And he was working part-time for a government department, and he was working alongside a woman whose husband was an Alexander Technique teacher, and she was talking to him about Alexander Technique and, how it can help with back pain. And then he relayed that to me. And then I got an introduction just through my social network, in the years before there were Facebook friends. It was
Real friends.
real friends, talking to real friends, talking to colleagues and so on. And a word of mouth really is what it was. It was word of mouth.
Mm. Yeah. Interesting. So for people listening to this now that maybe never heard of Alexander Technique, or they might have heard of it, but still not quite sure what it is, how would you describe that to people?
Yeah. So I would describe it in terms of what it does, firstly. Something like 85% of muscle tension comes from, 85% of back pain comes from what's called myofascial pain, which is the muscles and the fascia. Don't worry about what fascia is. It's basically, and that basically comes from muscle tension mostly. So muscle tension leads to back pain. We know that. But where does muscle tension come from? Well, that actually comes from the brain and the nervous system. So if you want to stop being so tense, you can have a massage, or you can go and get dry needling, or you can go to a chiropractor, and they'll make your muscles less tense. But if the tension's being driven by your brain and by your nervous system, well, guess what? It comes back. And that's why it's good to be a chiropractor, is because the person's going to come back in 2 to 4 weeks for another treatment, and it's going to keep going because you're addressing symptoms and not the cause. So Alexander Techniques works very well with chiropractic and, massage and dry needling and a lot of those things, because it actually, while those things address symptoms, which can give you some good relief, addressing the brain and the nervous system is actually what's going to change, which is going to stop that from coming back, because you're removing the cause, not just treating the symptom.
So would I be right in thinking that, treatments like massage, dry needling, chiropractic, with regards to the person, they're passive? You're lying on a table, you're having something done to you. Whereas, would I be right in saying that Alexander Technique, the person is active in the process rather than just laying there passively? Yeah.
That's right. It is active versus being passive. And it's a bit like, there are other back pain treatments like, exercise and stretching. Those are examples of other active treatments. It's just that Alexander Technique is like 10 times easier than those.
Yeah, interesting. Yeah, and I guess, like you said, there is a place for all these modalities. I don't like using the word treatment if it's an active process, because to treat someone, you're doing it to them. So, I might give a massage treatment, right? But I wouldn't give someone an exercise treatment, right? They have to do that themselves, right? So I prefer the word modality to treatment, because it covers all potentialities. So, a lot of people seem to accept that back pain, is just a part of getting older or working in certain jobs. From what you've seen, how accurate is that belief, and how does your work challenge that?
Yeah. So my dad says too many birthdays about age-related. And look, there's no doubt that, there are age-related degeneration in tissues, in like the discs, and in, it does, there's no doubt that can be a cause of, of distress in your system. And there's also no doubt that, doing things to your body which it wasn't really designed to do, be that bad ergonomics or be that repeatedly lifting really heavy things, that's going to cause wear and tear on your system as well. And there's other things besides. You could get, bone cancer, or you could get a traumatic injury from a car accident or something like that, or you could get roundhouse kicked by Chuck Norris and put your neck out. So look, there's all these different ways of getting back pain. But the Alexander Technique is interesting because, there's this sort of feedback loop where there's something wrong with your muscles or your tissues, and that causes pain. And then the pain causes your brain to basically create more tension, and more tension creates more pain. Now you can, to use treatment in the sense that you kind of describe it, which I think is a useful distinction. You can get, medication to numb the pain, or opioids, or, non-steroidal anti-inflammatory drugs to reduce inflammation. You can zap the nerves with, radio frequency ablation, or you can get TENS to kind of disrupt the nerve pain signals, all of these things. But if you haven't, but you're still it's going to come back, and this feedback loop from muscles, pain, brain. I say strain, pain, brain. That feedback loop's going to keep coming back, and in some cases, that continues even after the original injury is healed. So you might have had strained a ligament or something, and that's healed, but you're still getting pain, and that's because of this feedback loop. So, Alexander technique is it sort of disrupts that in a number of ways.
Yeah, that's kind of the same kind of philosophy that I look at the body, and I work with a lot of people that have had chronic pain, or they're in chronic pain. Sometimes there was an initial injury, but it might have been 7 years ago, right? So there were no cells in their body now, right, that exist compared to when the injury happened. So why are they still in pain, right? The tissues aren't damaged. The tissues, the cells are not even there anymore.
They've been replaced.
Right? They've been replaced. So there's something, if you like, non-physical that's keeping the pain there, right? So when someone first comes to see you, what's the most common misunderstanding that someone might have about their back pain?
Well, my first step is to say, go and see a physician, like go and see a doctor, get a formal medical diagnosis before you come and see me, because I'm not qualified to prescribe x-rays. You might have a tumor, you might have a slip disc, or a hernia or whatever. So that's always the first thing. But beyond that, misconceptions, people are used to being treated. They're used to, in the sense that you used, they're used to being poked and prodded and stuck with needles and massaged and back cracked and all this kind of stuff. And they sort of feel like they need something done to them. And the reality is that a lot of what is wrong with people from a back pain perspective is, if not caused by brain and nervous system activity, miscalibration, inappropriate messages from the brain and from the nervous system. So a lot of it is, if not caused by that, at least that is contributing to it. And while you can't necessarily, if you have a degenerative disc disorder, that while that might be a physiological reality, you can see it on an X-ray. The discs have been crushed and there's a bit of inflammation. That might well have been caused by too much tension around your torso, crunching your vertebrae together. And it might be true that if you remove a lot of that tension using your brain, that your discs feel a bit, your nerves around there feel a bit better. And so the shift that I made in my very first Alexander technique lesson was to understand that I'm actually in charge of a lot of this stuff. I potentially have the control over this. I just don't know how to drive the car yet. But I've been in the passenger seat, and I've had all of these other clinicians driving me around and telling me what to do, and basically saying, you've got this, you've got that, you need this, you need that. But actually, I can sit in the driver's seat, and if I actually learn how to drive, I can make a radical difference to my own health.
Yeah, I guess the medical model that we have almost, I wouldn't say discourages, I'm not sure what the right word is, but it's almost within the interests of the medical system that you do feel like a passenger, that you need to have something done to you, because that way, they can charge you, right? If something has to be done to you for you to get better, and also if it's not addressing the root cause of the issue, well, guess what? Now you're a repeat customer, right? But if someone teaches you how to heal yourself, now there's no repeat business, right?
You've put your finger on a big weakness in my business model, Lee.
Yeah, well, mine too,
Yeah,
right?
I had a guy who, if I may, I had a guy
Yeah.
who had 30 years of pain. He'd been diagnosed with scoliosis when he was quite young, and he had 30 years of pain, and he had 30 years of doctors telling him there was nothing to be done. He had scoliosis, and I worked with him for a couple of weeks, and the pain went away, all of it. Well, he said 90% of it went away. And then I said, "Do you want to come, do the extension of the course, like, go into the next section?" He went, "No, I don't need to. I've got what I came for. The pain's gone away. Why do I spend any more money?"
Yeah. Yeah, we've both got terrible business models, but
Yeah, there's a lot of satisfaction though. Like it's like you. I feel a bit like I've taken a bird with a broken wing and I've kind of nursed it back to the health and given it the little worms to eat, and and then you just sort of like release it and it flies off, and you're like, okay, well, I guess that job's done there.
Yeah. Yeah, I guess it depends on your value system. It sounds like yours is probably similar to mine. I'm in this business to help people. I'm not in the business to make myself rich, right?
Yeah.
If I was here just to make money, I could still work in health in a different way. Even, I could probably just go and work in a gym as a personal trainer and earn a very, very, very good income.
Mm.
I mean, I would be extremely bored if that's what I was doing, even though, I love exercise, but I like the variety of what I do. And also I like helping people. So if I was just teaching people how to exercise, I wouldn't really be helping them to actually achieve their goal. Yeah, there's going to be benefit to it. Of course there is. But at the end of the day, I'm in this business to help people, well, partly get out of pain, because what I've seen in other people and I've experienced myself is that when you're in pain, now there's limitations to what you can do in life. Someone might call you and say, "Oh, we're going to go and climb this mountain at the weekend, and it's going to be really great." Then you think, "Oh, I'd love to do that, but I've got a really bad knee. There's no way I can do that." Right? Or it might be some people, they've got a bad lower back, and their son or daughter said, "Oh, can you come and look after your grandchildren this weekend?" And it's like, I'd love to, but no, I can't, because I can't bend down. I can't pick them up. I can't do whatever. And, for me, pain is just so limiting. There's so many limits on what you can do in life. And for me, I love it when I'm able to help people uncover the root cause of the pain, to empower them to take the responsibility for it, and then get out of pain, get functional again, and be able to live a life without any limitations. Meet Barry, a passionate golfer and former personal trainer who came to me with a few challenges: lower back and knee pain, poor posture from long hours sat as a London black taxi driver, and a desire to improve his golf performance. Following a detailed assessment, we didn't just address his physical concerns, but also took a deeper look at his lifestyle and nutrition. I introduced Barry to metabolic typing, a personalized way of eating that completely transformed his energy levels, reduced anxiety, and even alleviated his pain within weeks. With the right food and a sports-specific training program tailored to his goals, Barry has gotten stronger, more mobile, and more confident. He's deadlifting over double his body weight, making strides with his golf swing, and most importantly, feeling calmer and more positive in life. If you're ready to make real lasting changes in your health, fitness, and life, just like Barry, I'd love to help you too. Reach out today for a consultation at www.bodycheck.co.uk and start your journey to optimal health.
Tell me more about your modalities.
Yeah, so I combine 4 main modalities, if you want to call it that. So the first is physical / biomechanical. So trying to optimize someone's biomechanics, their posture. So again, within that, there's 2 main phases, if you like. So there's corrective exercise to try and realign the body as best as possible. And then there's high performance as well. So it's not just about getting people well aligned. It's, well, let's get you strong enough to be able to do what it is you want to do without, getting injured again. The second area I would say is nutrition / functional medicine. Because again, that can have a big effect on the muscular system. The third area is hands-on manual therapy. So I'm trained in sports massage therapy and trained in active release techniques, which is amazing. And then the fourth area, I'm an emotion code practitioner as well. So I work on the emotional aspects in the body as well. So I come in it from 4 different aspects, if you like. So the other thing I was going to mention as well there, when you were speaking, you were saying, you might go and get a scan and you might be shown to have degenerative disc disease, or, it might be disc herniation, whatever it might be. The other misconception I think that people often have with that is, oh, I've got that, therefore that's what's causing my pain. Right? Because I think it was a study by Booz many years ago. They did MRIs of people that had back pain and people that didn't have back pain. And what they found was that 76% of people that didn't have back pain had significant damage to their lumbar discs. Right? So what does that tell you? It tells you that just because you've got damage to tissue doesn't mean you're going to be in pain. Right?
Right.
And then there'll be other people, they've got really bad lower back pain and they'll get a scan of their lower back. There's nothing on the scan. Right?
Right.
So again, that's where you just need to be careful. I mean, sometimes, someone will come to me and they'll say, yeah, I've got lower back pain on my left side. I've got sciatic symptoms shooting down my left leg. My left leg's a bit numb. And so, right, okay. And they show you their scan results and there's a posterior lateral left disc bulge and it's like, okay, everything's adding up. Right. So you kind of think, right, we need to do something to try and re-centralize the disc and, get you nice and strong and optimize your posture in that lumbopelvic region. And when I first started doing this kind of work back in 2001, a lot of the clients that were coming to me, they were purely biomechanical issues. And that was all well and good because back then that's all I knew what to do initially as I was going through my training. But then obviously, as you get more education, the universe starts sending you people that are a little bit more complicated. And then that allows you to incorporate more of your training, which is always really interesting. So I just think that's a really important thing for people to bear in mind, is just because there's damage to a particular tissue doesn't necessarily mean that that's the source of the pain.
Right.
So pain is often discussed purely in physical terms, as we've been talking about. But what role do you think our thoughts, emotions, or even stress levels play? And how does the Alexander technique help people navigate that mind-body connection?
Yeah, good question. Okay, so, there's this model of pain called the biopsychosocial model that recognizes that there are, physiological factors, but there are also, emotional, maybe even thought, conceptual factors, that it involves relationships, that it involves your relationship with your work. There's all of these different things that affect pain. And the main mechanism you would probably say is via the autonomic nervous system, right? The fight or flight, sympathetic nervous system that arcs up when you get chronic stress, and then that releases a cascade of, chemicals, adrenaline, cortisol, and so on, and that sort of stiffens up your muscles and can affect the way you process pain. So, and that's why there are treatments for back pain, or I guess you'd say treatments, modalities maybe, like cognitive behavioral therapy and cognitive functional therapy, which sounds like a little bit where you're coming from, acceptance and commitment therapy, which are really nothing about your hardware, your physiology. They're really just the way you think about it. So how does Alexander technique work? Well, it's an interesting question, and there's a recent paper by, I think, Murray Hodges, Tim Cacciatore, Rajal Cohen, which sort of goes into this. And it's all, to be fair, it's all actually pretty speculative. So it rebalances tension in your body, which reduces pain from, nociceptors in your muscles, the pain, the nerves that actually detect pain. There's some suggestion that it actually not slows down, but it kind of attenuates the way pain's processed in your nervous system. So reversing what's called central sensitization, which is where your nervous system kind of amplifies the pain that you're experiencing. And in some cases, starts fabricating pain in parts that aren't actually injured. And it starts making things painful, just like the touch of a feather, because your nervous system is kind of miscalibrated. So there's a suggestion that Alexander technique kind of reduces that. Then it also so there's kind of two main ways that muscles are controlled that are complementary. And one's called the voluntary motor system, and the other's called the automatic postural control. And they work on different muscles, different types of muscles, and different locations of muscles. So the automatic postural control works mostly on type 1 slow twitch fibers and ones that are close to the spine, like multifidus, for example. And if the automatic postural control gets too lazy, then the voluntary motor system takes over and uses different muscles, uses type 2 fibers more so, the fast twitch, in muscles like spinal erectors to kind of compensate for the laziness of the automatic postural control. So what you need to do is rehabilitate the automatic postural control so that the voluntary motor system can actually stop clenching down in order to stabilize things. Because the voluntary motor is doing a job, right? If your automatic postural control isn't really working, then your voluntary motor system kind of takes over because it sort of feels like it needs to. And that's the other reason that things like, manual therapy in isolation may not be successful in the long term, is because they're not actually addressing the laziness of the automatic postural control. And you really need to recruit that back into the picture. Now, exercise is an important way of doing that, but exercise uses the voluntary motor system to perform your movement goals. So you sort of need to do your exercises in such a way that that the automatic postural control kind of gets the message and adapts and starts to create the neurological change from those exercises, the neurological change in your automatic postural control. So that's probably a bit technical, but I guess what I'm saying is that the Alexander technique actually. So the other thing about the automatic postural control is it's unconscious. It's not controlled consciously. So you can't actually, when you say, okay, so pull your shoulders back and suck your belly in, all of that stuff, that's using voluntary motor system. So it's moving your spine and your shoulders, to be sure, but it's not actually engaging your voluntary, your automatic postural control. And you need to do things that do engage your voluntary your automatic postural control. And one way to do that is Alexander technique, because it actually, one of the things that F.M. Alexander, the founder of Alexander technique, one of his genius discoveries, in my view, is that he figured out how to whisper to the automatic postural control. Now, the automatic postural control is involuntary. You can't make it do anything, but you can actually whisper to it by using particular cognitive strategies to re-engage the automatic postural control. And that's part of it, is re-engaging the automatic postural control, attenuating the voluntary motor system to reduce tension, to reduce, you'd be familiar with, trigger points and ischemia and all of that, and to re-educate your pain system. So it works in a lot of different ways, and I don't think it's all completely well understood. I don't think the people who write papers about it would claim that it's well understood, but there's a lot going on.
Mm. Yeah, it's really interesting because, I'm very aware of that whole concept, but I'd never heard it called automatic and voluntary systems. So, I think you mentioned the slow twitch and obviously fast twitch muscle fibers. That would be, the automatic and the voluntary. We tend to call it type 1. Obviously, there's type 1 and type 2, but we also call it the tonic and the phasic systems, whereas you call it automatic or autonomic, automatic and voluntary. We call it type 1 or type 2 or tonic and phasic systems.
Yeah.
The other thing, I guess, is quite important as well when we're talking about the automatic, is that those muscles also become inhibited when there's pain in that region. So the type 1 muscle fibers tend to become inhibited when there's pain. Well, that's called a pain inhibition. So now your voluntary system, or phasic system as we will call it, now tries to do the job that the automatic muscle should be doing. But of course, they don't have the fine motor control, and they also don't have the endurance that the automatic muscle fibers have.
Yeah.
So again, that's potentially going to lead to, excessive wear and tear, across a joint, for instance. The other thing as well that can cause a similar inhibition of those muscle fibers is inflammation of an organ, a viscera. So it's called a viscerosomatic reflex. And that's where, in my work, something like nutrition can actually play a really important role in getting to the root cause of the problem. Because if someone's eating something that's inflaming let's say it's their small intestine, let's say, well, the type 1 muscle fibers in that region, particularly the transversus abdominis, which is one of the biggest stabilizers of the spine, the pelvis, and the rib cage, is going to be inhibited. And then when you look at sport as an example, when do most injuries happen? Towards the end of the game, right? Well, if someone's got inhibition of those type 1 muscle fibers, the type 2 muscle fibers at some point are going to get fatigued because they're trying to do two jobs. Right. And then once they're completely fatigued, now there's no stabilization or very little stabilization of the joints. Now there's more likelihood of injury. Are you struggling with carpal tunnel or any other persistent pain that just won't go away? Josie, a 40-year-old sales trainer, came to me after suffering from worsening carpal tunnel symptoms for over a year. She never imagined that such quick results were possible, but after just 3 sessions, her symptoms were nearly gone. Her improvement was so remarkable that she describes what we accomplished together as nothing short of a miracle. Words can't express how grateful she is for the relief she's found, and I couldn't be happier for her. If you're tired of dealing with pain and want to experience real, lasting results, I'd love to help. Request your consultation today at www.bodycheck.co.uk and let's start your journey to recovery. Going to occur.
Okay. I didn't know that. So that's very interesting kind of detail about inhibition and fatigue that I wasn't aware of. So that's very interesting.
Yeah. And again, when someone comes to see me, when I'm first, interviewing them about their pain, if they say, oh yeah, I wake up in the morning and it's pretty good, or there's no pain at all. But as the day goes on, the pain starts to get worse. And I'm thinking, okay, that potentially could be some kind of inhibition of the type 1 muscle fibers. So we would label that as what we call outer unit dominant rather than inner unit and outer unit harmony, if you like.
Yeah.
So yeah, that's quite interesting. And again, that's why it's so important to look from all angles so that you are finding what the root cause of the issue is. So in terms of the how is it, as an Alexander technique practitioner, do you help people navigate that mind-body link? How do they actually do that?
Yeah. So, look, it's Alexander technique is traditionally taught one-on-one in person, and it's a hands-on modality, but it's not manual therapy. You're not doing something to them. You're using your hands to communicate to people what they're actually doing with their muscles and what they could be doing instead. So you're sort of making gentle suggestions to their nervous system about how they could organize themselves to recruit more so the type 1s and calm down the type 2s and kind of re-coordinate themselves. So that's basically how it works in a lesson. You're giving them information with your hands, but you're also instructing them on mental commands, what are called directions in Alexander technique. And this is what I was sort of alluding to before, what I regard as the genius of FM Alexander is he figured out these directions, which are ways of, inhibiting your voluntary motor system. So I guess in terms of what you were talking about before, I draw the distinction that voluntary and automatic control systems are in the nervous system. And the type 1 fibers and their inhibition of those is actually in the musculoskeletal system. So the voluntary motor system and the automatic postural control actually they start in different areas of the brain. So the voluntary is sort of prefrontal cortex, premotor cortex, motor cortex, M1 kind of area. And then that talks to the basal ganglia and the, the brainstem and, the corticospinal, corticobulbar tracts. And it uses what's called the descending pyramidal pathways. But then the automatic postural control actually uses a different part of the brain. It uses more the cerebellum and more the brainstem, and it's called extrapyramidal. So it's actually, and it's a different set of neurons that go down the spine. They kind of converge on the same, what's called alpha motor neurons, which are the ones that go the last mile to the muscles. But we're talking about two different subsystems. And you got to sort of treat them as different subsystems in this work. So what you want to do is inhibit the voluntary motor system, which inhibits all of that. What did you call them? Exterior units or something? What did you call them?
The voluntary.
No, you had a word for the muscles that are close to the core versus the ones that are outside.
Tonic.
Okay, there was a different word. I can't remember what it was. But in any case, what we want to do is use our mind, our directions to inhibit the voluntary motor system and then give gentle suggestions, usually via imagery, that somehow magically activates the automatic postural control. It gives the automatic postural control a template of how to organize the body, and it then just goes and does that without you having to micromanage individual motor units or muscle groups, because the automatic postural control, it knows what good coordination is like, and you can't get that by tightening your core or by pulling your shoulders back or doing any of these voluntary motor activities, because it's a different neurology. It's a different part of the nervous system that does all of that. And what you want to do is stimulate the automatic postural control. And that's what in Alexander technique, FM Alexander took 10 years to figure out, and then started teaching it.
So what kind of wording might be used in that example?
Right. So the first thing, Alexander had what he called directions, which are directions for you to give to yourself. Now they're called directions, but they're not really like, shouted orders. They're really just gentle suggestions at, volume 3 out of 10. But the first one is just, I allow my neck to be free. Now the way we're thinking about the neck here is that there are muscles. There's something like, I counted them once, there was something like 120 muscles. I think there's 600 odd muscles in the body, but about 100 odd actually run between the head and the spine, or the head and the scapulae, or the shoulder blades. So, like the trapezoids are a big muscle group. Okay, they go from the kind of the back of your neck out to your shoulder blades, and then down to your thoracolumbar fascia and connects, to your spine and all of that stuff. So, but there are some small ones as well, a lot of small ones. And they're all around the neck. They're like, you see those people wearing like a collar if they've had whiplash. And you can think about muscles being a collar around your neck. Now, if you take like a radio mast, for example, that has all these guy wires down stabilizing it, and if you pull all of those guy wires at the same time, the mast doesn't move, but it gets compressed. It gets driven into the ground, and there's compression all the way up through there. Now, if that's your spine in your neck, the cervical spine, and you tense all these muscles all the way around, you're compressing the discs in your spine, and you're inviting chronic tension, which can lead to, like trapezoids is a classic place to get trigger points, but you could also get, disc compression, which can lead to, all the problems that wear and tear and degeneration and all that kind of good stuff. So the first direction is I allow my neck to be free. And what we mean by that is all of those muscles around that are kind of up and down and crisscrossing a little bit and a little bit diagonal, we want to allow those to just release, and we're inviting length. We're not trying to like push our head up, but we're just inviting release in those muscles. And it's a little bit like if you've got a balloon that's kind of tied, like a hot air balloon that's sort of tied to the ground, and you just start releasing the ropes a little bit. Your head can kind of, it floats up a little bit. It doesn't, float up off your spine, but the vertebrae can just decompress a little bit, and you can just get space between your vertebrae, and you can get length in the muscles and just take the tension out. And so that's a skill. That's a motor skill to be able to release your head and your neck. Now, I remember not long after I started Alexander Technique, I used to ride a skateboard, right? I used to do that for fun, and I used to go out skating for hours at a time. And there's a particular maneuver on skating called an ollie, which is when you smack the tail on the ground and you jump in the air and the skateboard comes with you. And I was skating not long after I started Alexander Technique, and I smacked the tail and jumped in the air, and I felt this clenching in my neck and actually in my whole body. And I was just like, what was that about? And what I figured out was that I had been doing that all along. And it was only through Alexander Technique that I started to develop sensitivity to that tensing of the neck. So when you start the work, you may have no idea that you're tensing your neck or how much you're tensing your neck. And you don't need to know. All you need to know is the direction. I'm letting my neck be free. I'm releasing tension from all the muscles around my neck. I don't know if that's happening or not. I don't know if they're tense to begin with. I don't know if it's any better now. I don't necessarily have to get a feeling about it, because it actually works, and the actual sensitivity comes later, funnily enough. It's kind of a bit of a leap of faith, which is also a bit of a problem for the business model, because, you're teaching people skills that they don't actually appreciate the benefits for straight away. But, as in the case with my skateboarding example, pretty soon after a few lessons, it became obvious to me that my neck was really tense, and it was far worse when I was trying to do something. Like my first reaction to any activity was to kind of like clench my whole neck. And that was just part of how I was getting through life. And I had to learn how not to do that. And the first step of that is the first direction. Allow your neck to be free.
So would it be right in thinking a large part of Alexander Technique, and I'm sure there's more to it, but a large part of it is to get those voluntary muscle fibers to, I guess, stop over contracting? Would that be fair, or is there a lot more to it than that?
Well, that's half of the picture. So it is a lot of it. Definitely is a lot of it. In Alexander Technique, we talk about direction and inhibition. Direction is what you want is you're whispering to the automatic postural control about how you want your body to be organized. So, for example, this won't make any sense to you probably, but, allow your neck to move forward and up off the top of your spine, to allow your back to lengthen and widen and your knees to go forward and away from each other. Now you have to learn what that means and then how to teach your automatic postural control to do that. That's direction. The inhibition side of it is I'm allowing my neck to just be free, to be still, to do nothing with my neck. So that's your question was, is inhibiting the voluntary motor system a big part of it? And it is. That's what we're doing when we're saying allowing my neck to be free. And we apply that skill of inhibition to everything in the body.
Gotcha. So I guess it's going to differ from person to person, but kind of how long does that process take for someone to be able to kind of put that into practice?
Yeah. I think I mentioned this guy who had chronic scoliosis pain for 30 years, and he took, so my course, I have less video lessons, and then I have group kind of coaching lessons. He'd watched a few videos, maybe a couple of weeks worth of videos, which means probably about 2 hours worth, maybe an hour and a half. And then he came to a group coaching lesson, and then after about half an hour, his pain was gone.
Wow.
So, there was a whole lot more I could have taught him, but that got him what he wanted.
Yeah.
Other people, for me, it was years and years and years. I was a very slow learner, and I've tried to address with my course what I see as some of the problems of learning Alexander technique to make it easier and more fun. But, for me, it was quite a while before I was in extremely bad shape, and it was quite a while before, I had definitely central sensitization and a lot of, almost fibromyalgia-like symptoms. And so I was in a pretty bad way, and I definitely had, anxiety and depression and, those, emotional situations that we talked about earlier. So, my own treatment was definitely multimodal. My own modalities were many. And it did take me a while, but, I always think about that. You may get a quick win or it may take you a little while, but, what's the alternative?
So from your own personal perspective, what was it that kind of gave you the confidence in the Alexander technique to kind of to keep going with it? Meet Josh, a tennis player who came to me after battling persistent lower back pain that was keeping him off the court. Despite a year of physiotherapy covered by his medical insurance, his condition hadn't improved. That's when Josh decided to work with me. With my deep knowledge across a wide range of areas, I took a detailed approach to assess and understand his pain. I don't guess about health issues. I research, collaborate, and deliver tailored solutions. Together, we designed 2 exercise programs. The first program helped relieve all of Josh's lower back pain, while the second program saw his physical attributes drastically improve. Josh's results speak for themselves. If you're struggling with persistent pain or looking to improve your game, just like Josh, reach out today for a consultation at www.bodycheck.co.uk and let's get you back to doing what you love.
I think I had an epiphany in my very first lesson because my teacher basically had me sit down and then gave me gentle, calming communication with his hands to my shoulders, and he started talking about freeing the neck. And pretty soon, my shoulders were killing me. And it was a particular sort of pain, the sort of pain you get when you've been doing maybe a yoga stretch or a stretch for a while, and your muscles are just, your muscles and your tendons and your ligaments are just kind of burning. But the pain of the actual, the tension, the tension pain kind of went down. It kind of was much less painful from that, what I was used to, that sort of hot burning tension pain, but it was replaced by this kind of stretching pain. And it was like my muscles were actually getting longer. And you probably know about the physiology of what happens when you stretch tense muscles, but was quite striking to me that all I had done was sit down. He'd touched me a few times lightly and given me a few ideas about how to think. And the physiology of my neck and my shoulder girdle completely changed. And I was just like, this is magic. Like, I've never experienced anything like this. And I could see in an instant or throughout the course of that lesson that this had the potential to actually create real change in my muscles and in my nervous system in ways that nothing I'd ever done had. And it was me doing it. It was a modality. It wasn't a treatment. It was an educational process. And so and subsequent work I studied Alexander technique for 25 years before I became a teacher. I studied it in Canberra, Sydney, Melbourne, Washington, D.C., Austin, Texas, New Jersey, Manhattan, I had a lot of Alexander technique lessons, and I studied it quite extensively because it just changed me in a way that it allowed me to change myself in ways that nothing else that I'd done had. It's like it opened up this control panel into my own nervous system that I didn't know existed. And all of a sudden it's like, what? I can do that. I can do this. That's incredible. It's sort of addictive. And I always say that, so we as humans have got two main motivation modalities. One is towards, like, I want that, that piece of chocolate. I want that experience. I want that thing. And the other is away from, like, I want to get away from pain. I want to get away from that person that I don't like. I want to get away from poverty, whatever it is. So my Alexander technique journey, like a lot of Alexander technique teachers, started with away from, because I wanted to get away from pain. I wanted away from this, this burning pain, discomfort, muscle tension, like trigger points, aching. I wanted to get away from that. But once that was gone, and it is gone, it's the towards, because it's addictive having that much control over your own body and your own mechanism. It's really, it becomes who you want to be, how you want to be.
Yeah, it's interesting. An analogy that just came into my mind then, it's like, when you're growing up and, your parents drive you everywhere you go. And then, you get into your late teens and you start learning how to drive, and then you pass your driving test, and now you can drive yourself wherever you want to go.
Yeah.
Right. It's now you're in control. You're not being controlled by someone else. You're actually, the car is almost like a status of freedom, isn't it? And I guess learning the Alexander technique for you was like a state of freedom, freedom from your pain and freedom to be able to do whatever you want to do.
Yeah. Yeah, absolutely. It's a great analogy.
So have you ever had a client whose transformation really surprised you? So someone who experienced more than just symptom relief? And if so, could you walk us through that story?
Yeah. I mean, one of my students who went on to become a teacher, and I was assisting on the teacher training course, but when I started, he's a drummer. And when he started, he was having all this hip pain and he could hardly get through a gig. And he was looking at the end of his career as a drummer and just to be a teacher. And he was heartbroken about it. Anyway, did some work with him. Well, he did some work with me is probably a better way of putting it, because in Alexander technique, the student does all the work. He did some work with me, got rid of the pain, could play for hours, happy, went on to become a teacher. And he said something like, he didn't think he had a chance. And then he was offered this second chance at wellness again. And he grabbed it with both hands, and now he's a teacher, and now he's passing that on to other people and really flying with it.
Do you remember what you did with him? So you say it was his hip. can you remember kind of the process that you went through?
Yeah, sure. So I guess it's useful again to just touch on the difference between the voluntary motor system and the automatic postural control, because with the voluntary motor system, you're dealing with individual muscles. A lot of the time anyway. You can work with individual muscles. You can rehabilitate particular muscles, strengthen this, strengthen that, stretch the other one. With the automatic postural control, you're dealing with a postural system that actually already knows how to organize itself. It's just fallen into dysfunction. So you're actually, in Mark's case, so you asked about, do you remember exactly what I did? I did what I do with every student, which is teach them how to inhibit muscle tension, voluntary muscle tension, and engage the automatic postural control. It works every time, and you don't have to actually understand too much about the biomechanics. I mean, the stuff that you know about this would be 100 times more than me, because I don't really, I don't really worry about it. I just sort of think if you can activate your automatic postural control, it knows how to coordinate your hip. It knows about anterior pelvic tilt, and it knows about pronation and supination of the leg and all this. I don't really have to worry about that. I just have to actually, and when you do work on hands-on, and I did quite a lot of work with him hands-on, you do use your hands to help them reorganize, but you're guided by their automatic postural control. You don't go in there saying, I want to make this muscle stronger, or I want to move this into that position, because that's kind of, from an Alexander perspective, that's kind of micromanagement using the voluntary motor system. What we want to do is use our mind to stop interfering with the automatic postural control and let that organize us, which is a different way of going about it. But from an Alexander perspective, it's a better way.
So when you're putting hands on, is it normally on the voluntary muscles? So you're trying to get them to calm down?
I think I don't really distinguish between voluntary and involuntary, the type 1 or type 2, because what we're after is an overall pattern of coordination, and what we actually want to do is communicate to the nervous system, not so much the muscles. And I'm sure you as a manual therapist, you know how you can put your hands on someone quite gently and you can feel into them, and you can detect patterns of tension and disorder just using your hands. So I do a fair bit of that. So just, when I do hands-on work, I mean, most of what I do is online these days, which presents different challenges and different opportunities. But when you put your hands on someone, you're feeling for, and you're not palpating, you're not feeling muscle tension, you're feeling the state of their nervous system and what they're doing with them, how they're twisting themselves up, and you're helping them inhibit that voluntary tension, but you're also giving these suggestions to stimulate the voluntary motor system to get them moving on the inside. So that's kind of probably the best I can describe it.
So in terms of when you're putting hands on, are they in a specific position? Are they standing, lying down, sitting?
Yeah, well, I mean, the traditional 3 Alexander technique positions are, well, I guess it's 4, or more, but, standing, sitting, and lying flat on a table. Not quite flat. It's called semi-supine. So you're lying on your back with your knees up and your heels sort of close to your butt. And those are the positions where the teacher normally has you in there, and there's quite a bit of standing up and sitting down from the chair, because that's an example. It's a very common activity, but it's one where, as I, with my skateboarding example, I was clenching my neck trying to ride my skateboard, but people often as not are clenching their neck when they just try and get out of a chair or even sit down in a chair. So sitting up or standing up and sitting down are sort of it's a useful little kind of uh, movement that is common and it can be used for kind of practice purposes, diagnostic and practice purposes.
Mm. Yeah, you mentioned earlier about a drummer, and I know you've worked quite a bit with musicians. What have you discovered about how posture and movement influence not just comfort, but actual performance and expression?
Well, I mean, quite a lot. I mean, when you listen to someone play, when I listen to someone play, I'm actually listening to their feelings and how they're expressing themselves and how that's communicated through their body and their instrument. That's what I'm really interested in as a listener. I don't really care if they can play a million notes or not. I want to feel something. And one of the challenges of being a musician is you need to be able to execute particular movements, but you need to be able to still be in touch with how you're feeling and how that flows through because your nervous system and your muscles are completely different if you're feeling tense versus if you're feeling happy, if you're feeling like open and exuberant versus, trying to control everything. The nervous system doesn't lie, and you can hear that when someone plays.
Given your background in engineering, do you find that you approach the body differently, perhaps with more precision or structure?
Yeah, I think it's there's no doubt about it, really. I mean, Alexander technique is really the way it's taught is very right brain, very creative, artistic. It's taught in the Royal College of Music and the Juilliard School, Conservatorium. It's taught at, the Juilliard School of Acting. And there's all of these quotes by everyone from Hugh Jackman to John Cleese, William Shatner, all of these actors and musicians and dancers who've all studied Alexander technique and, and all about how wonderful it is. And, I'm an engineer, right? I don't really, I didn't really relate to a lot of the more kind of airy-fairy artistic conceptions that come with Alexander technique. I just really think about it in terms of, well, I guess in the terms that we've been using to discuss it today, in terms of the nervous system, the muscles, the tissues, the joints, how all that works, and how I've a lot of what I've communicated today about how I see it working is not really mainstream Alexander technique. It's just what I figured out. And there's a few good researchers. I mentioned some of them before. Tim Cacciatore and Murray Hodges, Rajal Cohen, and others who are doing really interesting scientific work. But I think that's the side of it that most interests me. And I think I want to be able to explain it to myself. And I also want to be able to, sometimes you get into an Alexander technique lesson and you start telling someone, oh, okay, so you've got to, let your neck be free. And it just sounds really woo-woo and like kind of quasi-spiritual nonsense. And I think I've approached it more as an engineer and as someone who's interested in medicine and physiology, because I really feel the need to communicate that there's that it handles physiology in a very substantial and meaningful way.
Yeah, I think it's always important to try and combine, if you like, the left and right brain aspects of things, because in the Western world, I think we are taught in the education system purely in the left brain, right? But it sounds to me like Alexander technique is very much in the right brain. But if you can combine the two together, I think anything's a lot more powerful.
Yeah, well, I think for me, I combine it mostly in music because I approach music creatively, but I use Alexander technique in a fairly structured way to change my body and my mind so that I can be more creative. And yeah, I mean, teaching it is is often quite a creative process. I mean, I make the videos that explain the physiology and the neurology and all that kind of stuff, but then when it comes to actually the face-to-face sessions, it's usually quite a creative process.
Yeah, you can imagine. Ben, this has been really interesting, but what's next for you? Got anything coming up in the pipeline?
Yeah, well, I'm relaunching my online course. I did it last year, and of the people who, a number of people completed the course, and they averaged going from 24 days of back pain a month to only 4 days of back pain a month. So they achieved quite they got rid of a lot of pain. They reduced the number of days a month by 80%. So that was immensely gratifying for me, really satisfying. And I've actually, I've enhanced the course and I've kind of rewritten it basically from scratch. And I'm creating a webinar at the moment. So that goes into a lot of the stuff that we've talked about and, talks about the Alexander technique and where it came from and why nobody's heard of it. And then a little bit of basic instruction on how to start doing it with, the neck free and so on. So that's really exciting. I've actually, in my frustration about how complicated neuroscience is, I've actually created a narrative that involves superheroes in a reality TV show. So we've got the conscious mind, who's called Nova, and then we've got the voluntary motor system, who's called Fizz. And then there's Jed, who's the automatic postural control, and there's Biff, who's the musculoskeletal system, and then there's the baby, who's the pain processing system. And so I sort of have like 7 episodes of how all these characters interact and, how they all work, how they work together, what can go wrong, how treatments work. For example, the difference between, CBT, cognitive behavioral therapy, which treats Nova, versus TENS, which actually treats the baby and disrupts the nerve signals and how these all work with the feedback loop of pain. So that's been a lot of fun, and I'm probably going to go live with that, 3 or 4 weeks, I guess, if I keep on making the progress on that. And then once I've done that, then I'll probably reopen the course again and start teaching people how to do it for themselves.
Awesome. Great. And for those who, want to dive deeper or connect with your work, where's the best place for them to find you?
Okay. So go to www.backrepublic.com, backrepublic.com. And at the moment, there's a link on there that takes you to a questionnaire, a scorecard that you can use to sort of have a look at your own pain, your own back pain, your own experience of pain, what the future may hold, and what options you've got. So that can be quite interesting for people. It only takes 2 minutes. So backrepublic.com, and then there's an orange button that'll take you to the scorecard, and you'll also get on the mailing list to hear all about the content that I create and the opportunities to get involved.
Awesome. Great. Ben, thanks again for coming on the show. It's been a really fascinating conversation.
Yeah, well, thank you very much, Leigh. It's really great. I've learnt a few very important things from you today, so that's been very, very useful. And it's great to talk to someone who understands the physiology and the neurology as well as you do, because we can sort of hopefully not confuse the listeners too much by going into all of the jargon, but it's very interesting for me to be able to explore those topics in such detail.
Yeah, awesome. So that's it from Ben and me for this week. But don't forget to join me, same time, same place, next week on the Radical Health Rebel podcast. Thanks for tuning in. Remember to give the show a rating and a review, and I'll see you next time.